Hello, my name is Dr. Mark Anderson of Mohnacky Animal Hospital. In this video, we'll be discussing hip dysplasia and total hip replacement as a surgical correction for severe hip dysplasia in those cases where medical management is no longer sufficient. My colleague, Dr. Zoran Djordjevich, or Dr. George as he's known to his clients, uses the Helica brand total hip replacement system. He was a stimulus in Helica developing their smallest acetabular cup that they offer, 24 millimeters. Dr. Djordjevich was also the first veterinary surgeon to implant the 24 millimeter cup. Next, Dr. Djordjevich will discuss hip dysplasia, total hip replacement surgery, and his unique technique, which has allowed him to achieve very favorable results.
Hello, my name is Dr. Zoran Djordjevich. I'm a head surgeon at Mohnacky Animal Hospital. Today, I would like to discuss about hip dysplasia, affecting primarily large breed dogs. It directly affects the development of the hip joint in a young dog, causing the muscular and connective tissue, including the ligament, joint capsula, and surrounding soft tissue to become lax and weak, loosening their ability to properly support hip joint. Symptoms depend on the severity of the joint looseness and the degree of the joint inflammation, as well as the duration of the disease. Usually, you are able to observe reduced activity, difficulty rising, reluctant to run or reluctant to jump, and sometimes they don't like to climb the stairs. The diagnosis of hip dysplasia requires proper history, examination, direct palpation of the hips, and radiographs. Some dogs' pain and discomfort can be managed medically, which include anti-inflammatory medication as well as physical therapy, and sometimes food additives. Surgical intervention is usually recommended to those that do not respond properly to medical treatment. Total hip replacement is a surgical procedure which involves removing a diseased hip joint and replacing it with an artificial joint called a prosthesis. Today we have a cementless hip replacement and cemented hip replacement. Total hip replacement is a procedure that can produce a functionally normal joint, eliminate degenerative joint changes, and alleviate pain. Using the Helica cementless hip prosthesis allows for the body's natural healing interaction, and these contribute to the painless post-operative weight bearing and rapid recovery. Helica replacement could be accomplished in a very early age, so the lifespan of prosthesis could be the same as a life of animal. Due to the improvements of the Helica system that we perform here at Mohnacky Animal Hospital, successful rate is very favorable. The surgery usually takes between 90 minutes and 2 hours, and within 1 to 2 days post-surgery, animal usually has been released. The patient is generally walking 18 to 24 hours after surgery. As long as patient has an eventful recovery, they are then discharged within 1 to 2 days of the surgery with limited exercise for 6 to 8 weeks. Once fully recovered, typically 8 weeks post-surgically, most dogs return to a near normal level of activity without any pain. The goal of total hip replacement is to restore the function of the hip back to a normal hip and give the patient a better quality of life.
Dr. George did an evaluation. He had some x-rays done. It was discovered that his back legs were in very bad shape. I believe we had an x-ray, and his hips were completely compacted at that time. It has been 7 weeks since Clyde had his operation, and when we came to get him that first week, it was amazing. Well, I just saw somebody this morning who said he even walks, he even holds himself differently. It made us feel that we had made the right decision. We just thought, this is amazing. This is amazing.
Total hip replacement is the most advanced procedure providing the best surgical outcome. In all of Dr. George's cases, the patients are mobile within 18 to 24 hours of surgery. We hope that you found this information useful and that this may be a procedure that would be beneficial to you and your pet that you didn't know previously existed. Thank you.